Hi, everybody. Judy Seeger here, back with another session in the Ozone Therapy Summit. So happy to have you on here, and our special guest, Dr. Mason Wood. Thank you so much for being on here, Doctor, today.
Hi there. How are you today?
Excellent. So here you are in Canada, Alberta, Canada. And so you're way up there north. As a naturopath, you have a whole program over there. So we're excited to get into your understanding of ozone therapy and your expertise to share with the world so that they understand really, truly how wonderful ozone therapy is and all the modalities that you use alongside of it. So first of all, Dr. Mason, well, can you please explain to us a little bit about your background? We know that I know that you've been at it for 16 years as a naturopath, but tell us a little bit more about your background and how you got into ozone therapy.
First off, I was in the mining industry. I grew up in the Yukon territory in northern Canada, and I was in the mining industry, gold miner, diamond driller. And in the mid-90s, there wasn't a lot of work around. And so it was either, keep doing this, one job to the next, or kind of non-consistent lifestyle, or go back to school. And I chose to go back to school option. And several years later, 8 years later, I became a naturopathic doctor and thoroughly enjoy what I do. Just wish I couldn't charge people, money, because it does cost, unfortunately. And ozone therapy, I started in 2011. I started doing PRP. And here in Alberta, when we were doing PRP, platelet-rich plasma, it was under the assumption that we had to do ozone therapy as well. And so I did Dr. Schellenberger's ozone course in the spring of 2011. And just ever since then, I've incorporated ozone into pretty much everything I do. On a daily basis, I use it for a wide variety of different conditions, some of which we'll get into a little bit later on, I suppose. But ozone is amazing. It's, from my perspective, it should be taught in schools. It's not, I'm not sure why, but they don't do it. And it is a modality that is useful in so many different aspects of life. My goal, my ultimate goal, is to have every person have an ozone machine in their house, because they can do a lot of home ozone stuff, whether it be doing home ozone ear treatments or rectal insufflation or topical skin treatments, ozone bagging, limb bagging, or ear treatments, or ozonated olive oil. There's so many different ways that it can be used at home. So that would be a goal that I have down the road.
Yeah, that's something that's one of the reasons we do the summit, to let people know that they could go to a clinic, get the IV done, and have pretty fast results. And then after that, they could go home and do that. And there's plenty of ways to use it, like you mentioned, that we're going to get into, but certainly can be done at home safely, effectively, and it's not that hard. So let's get into a little bit. You have a specialty as a naturopath in your practice. What is it that you work on mostly in your practice?
My main focus of interest is orthopedic medicine, treating knees, hips, joints, whether it be shoulders, whether it be old worn out knees, from osteoarthritis, or acute knee injuries. I had a little 12-year-old girl that had a knee injury from gymnastics, wasn't healing after 8 months of physio, and we did some prolozone on it, and 2 treatments later, she's fully healed up. And
so wait a minute, I know I love talking about prolozone, because I healed my own frozen shoulders through Dr. Harper's work, and I didn't even know that it could help frozen shoulders. And here I find out from you guys it's great for hips, like you say, to wrists, to knees, and all that. So first of all, let's explain to everybody, what is prolozone therapy?
Prolotherapy is where you use dextrose. Dextrose is an irritant, and it creates inflammation. Chronic inflammation leads to tissue destruction, anything longer than 2 weeks or 3 weeks. Acute inflammation leads to tissue healing. And so when we do prolozone, we're injecting dextrose into the joint to try and create acute inflammation. There's about 20 different growth factors in your blood, and we're trying to attract the blood to get those growth factors there to help regenerate ligaments, tendons, cartilage, and to heal the joint. And it doesn't matter, any joint in the body, fingers, wrists, as you mentioned, shoulders, neck, low back, knees, hips, a lot of ankle treatments, toe treatments. So any joint in the body needs blood flow. If you think about it, if you cut open a chicken before, ligaments, tendons, and cartilage are all white. and they're white because they don't get any blood flow. So in order to heal, you need to get blood there somehow. And all these therapies, acupuncture, shockwave, IMS, the main goal is the same thing, get more blood flow. But it just so happens that the injections are the king of doing that. Prolozone, PRP, they're the king of getting blood there to help heal the ligaments, tendons, and cartilage.
Yeah, and that's a really big deal. So dextrose is shot in, but then where does the ozone come in?
So what I do is I'll insert the dextrose, I'll insert the needle into the patient. I'll put the prolotherapy treatment, which is dextrose, procaine, a little bit of B12, a little bit of sodium bicarbonate to neutralize the pH. I'll leave the needle in place. I'll take that syringe off, and then I'll put the ozone syringe on and then inject ozone into it. Ozone has 3 functions in the joint. It helps to create microcirculation. It also helps to kill if there's any bacteria. They're starting to find bacteria in the knee, eating away at the cartilage, and ozone gets in to help to kill. Plus it helps to oxygenate. So gets more oxygen flowing, which I suppose is linked into the microcirculation part.
Right. So this 12-year-old, for example, that you helped, how long did it take before she saw results then?
We did 1 treatment. She went home, and in her case, she had a fractured kneecap as well. And so I told her parents to lock her leg up for 3 weeks in a Velcro cast so she couldn't bend her knee. And they did that. They came back and we did another treatment. And then they went back and did some physio for a month. And that was it. She was back at it, fully healed in a month and a half.
That's pretty severe. A fractured kneecap. Holy man, that's like, wow, that's a pretty big deal. A lot of people, athletes especially, don't come back from that. So that was one case, and you do all the joints. So as you're working on the joints and all that, we know that as naturopaths, that is very important to combine other modalities with this. That yes, ozone is powerful. Yes, it works. But what have you found works well with ozone therapy?
In terms of other therapies, I'm seeing some Lyme cases right now, and we're doing some other oral type things to help kill the Lyme, oral colloidal silver and glutathione and zeolite. So there's different oral supplements that also help to get in and work with the different condition. The one Lyme case I'm dealing with right now, I'll argue it's a very mild case of Lyme, but he still had a lot of rotating joint pains since he's been a kid. And this guy's in his mid-30s now. And we've done 18 ozone treatments. And after about the 8th or 9th treatment, he said he started to feel a lot better. And now his pain's pretty much gone. He'll have the odd flare-up every now and again, but way better than what he was for the rest of his prior life to this.
Yeah, for sure. Lyme is like the other reason I got into this in 2010 is I got bit by the bug and I got Lyme. And I was like, oh, no, I know what this is all about. And I didn't know anything about ozone therapy either. So I did the ozone therapy sauna because there was nobody who did the injections around me at that time. Yeah. And here I am, 2019, nothing's happened. No. And I had I had every single level of Lyme. I didn't even know there were levels. There's like 1, 2, 3, whatever, nothing. And it was, but I did ozone consistently, right? And I just kept at it. And I just think it was a big part of it, along with detoxing, along with making sure the food was good and all that good stuff. So when you combine and you do a number of sessions on this as IVs, do you also use the ozone in your clinic in other ways, or do you send people home with doing that? Like, how do you work out some of the other ways you can use ozone? Let's actually talk about that, because there's a lot of other ways you could use ozone that we touched on. So what do you like to use?
I've actually been having a lot of good success with dental ozone therapies for root canals. Patients that need to get a root canal, it's an infection, and you just need to get rid of that infection. You need to get something in there deep to get rid of that infection. And so when I first learned about dental treatments, I was just targeting the one tooth, whatever tooth it was. And then about 3.5, 4 years ago, I learned from a dentist at a Masters Ozone conference about how to do a nerve block on either the mandibular nerve or the maxillary nerves. And so we do a nerve block now, and then I'll target the tooth. And usually 1 to 3 treatments, the pain is gone and person is totally, healed, I guess, and doesn't need a root canal. And then I'll combine, have you heard of oil pulling?
I have, but let's explain it to the rest of the crowd.
So oil pulling, when I first started doing it, I was taking coconut oil and jojoba oil and then ozonating them a little bit. It's very time consuming. And so what I do now is I've got ozonated hemp oil. Ozonated olive oil in the fridge is a solid. Ozonated hemp oil is not, it's a liquid still. And so I'll get the patient to get some of their own coconut and jojoba oils at home. I give them a bottle of the hemp oil. Then I say combine 3/4 of a teaspoon or tablespoon of the coconut jojoba, and then 1/4 tablespoon of the hemp oil, and just swish it back and forth in the mouth for about 15 to 20 minutes. And it turns white and becomes very liquidy, and then you spit it out. And the oil kind of gets deep into the sockets, it gets in everywhere, and it helps to kill whatever's going on there.
Yeah, I tried it. Honestly, I couldn't do it. I hated the taste of it. But I'm a baby, so that's not good for me. But there's a lot of people who do oil pulling, and typically the oil pulling is done with sesame seed oil. Some people do with olive oil. But when you add the ozonated oil component, that's huge. That's like a massive difference, right? Because of the ozone in there. So do you tell people to do it on a daily basis, or how do you tell people to do that?
When we're doing the infection, like I'll do an injection once a week, and then in between, then I'll say daily, yes, do the oil pulling, and then come back, and then we do another treatment, and it's either 1 to 3 treatments, and people are totally fixed. Their pain is gone, and they don't need the root canal anymore.
Yeah, so that's what you're using for root canal. Have you seen it help with periodontal disease?
A little bit. I haven't really used it for that purpose too much, but a little bit. Another case that I'm thinking of is an ear oil treatment, kind of like you're wearing the earbuds like we're doing talking here. And we're pumping a dentist in Hawaii developed a system where it's a tube within a tube. The inner tube provides the ozone. The outer tube has a vacuum hooked up to it, so it sucks away the excess gas. The only contraindication to ozone is you can't get it in the lungs. If I was to fill this room up with ozone, it would kill me in about an hour. That's, just because our lungs cannot deal with the ozone. But any other way you can put ozone in. And so when we're doing ear treatments, I first learned about it, for a minute or two, because you got this excess gas floating around. Well, this is a neat system where you've got the inner tube providing the ozone, the outer tube's hooked up to a vacuum, sucking away that excess ozone. And I'll have patients sitting there for about 20 minutes. And I had a monotherapy or a mononucleosis case. And within 4 days, and I did some liver treatment as well, but within 4 days, 1 treatment a day for 4 days, his mono symptoms were completely gone. And I told him to finish off the liver treatment. And I saw his mom about 2 months later, and she said, yep, after that 4 days, he was completely cured of the mono.
Yeah, it's amazing how fast that works. So ear insufflation is what that's called, right? When you put it in the ears. And that is definitely very easy to do. It's great for kids. We don't want to scare them about the lung thing, because I know a lot of people are like, well, oh my goodness, then this is going to hurt my lung. It's just that it's too much oxygen coming in that your lungs can't handle, and it's just trying to get rid of it. And if, of course, just like if you use 100% pure oxygen, you could die, right? It's too pure. So It's just a matter of, listen, just use common sense, just use a little at a time, go slowly. And then you touched on something also, and you said that with this particular case, that sometimes you have to work on the liver. So as you're working with ozone and you're seeing different clients, do you also change your diet? Do you do detoxing? Do you do other therapies in conjunction with the ozone therapy?
Oh, yes, for sure. There's so many hormonal problems nowadays. And so
what do you attribute that to?
It's called the endocrine dirty dozen, and it's the top 12 things that are destroying the hormones. And, plastic water bottles, nonstick frying pans, heavy metals, mercury, lead, arsenic, each get their own category. Phthalates and parabens in your soaps and shampoos, solvents. It takes 2 years to off-gas a new vehicle. That new car smells benzene or formaldehyde. I should get some commission from Volvo. Volvo is the only vehicle that doesn't off-gas.
Which one?
Volvo.
Oh, Volvo. Ah, okay.
They don't have that new car smell. The problem here in Alberta is that everybody likes trucks, and Volvo doesn't make a truck other than a semi-truck. But
that's a really good point, and I want us to, just a golden nugget that I want people to pay attention to. So you called it the Dirty Dozen 12 endocrine disruptors, is that right?
If people just Google endocrine dirty dozen.
Oh,
The endocrine
endocrine dirty
system,
dozen. Okay,
the endocrine
perfect.
system is your hormonal system,
Right.
and the dirty dozen, top 12 things destroying that.
Right. And it really is an issue. I mean, I hear it all the time. I get calls every day, people with cancer that definitely their hormones are a mess, and definitely these disruptors have caused it. And you went through a little bit quick, but that's okay. It's a lot of it is chemicals in the water bottle, things that are found in the house, things that are just really synthetic. They're chemicals or things that are, like you say, disrupting the hormones. So when that happens, Doc, what is it that then you start working on with people that come in to see you with the hormones?
First thing is avoidance, avoidance, avoidance. Learn what this dirty dozen is and avoid them. And it's difficult to avoid everything, but we certainly can be doing a lot better. Plastic water bottles, get rid of those. Get a stainless steel or a glass water bottle if you're not going to break it, and get better sources of water that you're packing around with you. Get rid of your nonstick frying pans. They're full of chemicals that flake off and get into your food. Start eating organic food, the pesticides. If you buy a new vehicle, if it's another brand other than Volvo, roll the windows down a half inch and keep it open year round for 2 years to help the vehicle off gas as it's heating up.
I don't know how you do that in Canada. It's pretty cold up there.
Chilly, yes.
Yeah. It's almost worth getting a used car just for that. So you're talking about getting rid of all the stuff that's an issue. And then because the hormones, of course, are already disrupted and people come to you, they're already in a disease state. What do you do to start getting that balance?
So cholesterol we think of as a thing that causes heart disease. But when you actually think about what's the two main functions of cholesterol, the first main function, it's the precursor to all your hormones. And so if you don't have enough cholesterol, you're not going to have enough hormones. So I regularly see people in practice that their cholesterol is way too low. And we need to up that. And that's where the omega-3s come in. Fish oil, flaxseed oil, hemp oil. The omega-3s help to increase your cholesterol, which is then going to help to give you more to the precursor to all your hormones. Then adrenal dysfunction. Regularly, I find people are so stressed nowadays. They're drinking lots of coffee and all these energy drinks, and their adrenals are shot. And the adrenal glands provide energy. They provide us with feeling good overall. We wake up feeling good. So many people that have low cortisol, they've slept 10 hours, but they wake feeling tired, blah, and they can't get and so they need that caffeine to get them boosted, and then that even further destroys the adrenal glands. So treating the adrenals is a big thing.
So wait, you're taking away coffee from everybody? Oh my God, they're all going to be screaming at us.
I've been known to be that person. No more caffeine for you.
All right then. So there's all these things that they need to add on. It's not just doing the ozone therapy, which is my biggest issue as well, is to say, listen, yes, ozone therapy works, but you really got to work on some of this other stuff. So I want to jump over because our time, of course, goes so fast on these things. You had said that you like to use it for another modality, and I want to talk to you about that. You've gotten some success with that, and you had mentioned it's been good for herpes. So let's talk about that a little bit. You've had some experience with that. How do you use the ozone for that?
I've got a lot of cases with either herpes simplex 1, which is cold sores, or herpes simplex 2, which is genital sores. And patients just, it's a virus that hides out in the spinal column and comes out when you get stressed. You can feel what's called a prodrome, and that you get the tingling, and the next day you're going to get an outbreak. There's a variety of things you can do for that. But why have the virus hiding out inside of you? Why not just nuke the virus? And in the medical world, they can't get rid of it. But with ozone and vitamin A combination, we can nuke the virus and just get rid of it, and so that a person never gets another outbreak again. Usually,
so how would they go about? First of all, they're gonna all my Canadian people. I got a ton of people that are always watching the videos, so we're gonna send them over to you to Alberta. But yeah. What have you found is to be the best procedure for that?
I find doing the vitamin A. It's a certain high dose vitamin A protocol, and a combination with a couple of what are called chemotherapies, and their they're herbal type remedies. And so we do that. That's more of a home treatment. But then we'll do intravenous, called major autohemotherapy, where I hook up an empty bag to the patient. The one negative is you got to have good veins, because we're using a fairly large needle. So if your veins are trashed and difficult to find, it's very difficult treatment to do. But if you've got great veins and or even moderately great veins, and I can find it, then we hook an empty bag up to you, drop the bag on the floor. It fills up with your blood via gravity, and then as it fills up, I'm ozonating it. Once I have the right amount of ozone and blood in the bag, then I hang the bag back up, and it runs back in you, and it gets in and circulates with your own blood, and it helps to kill the virus. Usually takes about 10 treatments. I say, 1 a week for 10 weeks. And then in combo with this vitamin A protocol, we get in and nuke the virus. And people, there's been a couple of cases where it has not worked. So it's not, 100% treatment.
Mm-hmm.
But for the majority, 80, 90% of people, it's an amazing treatment to help just nuke the virus and get rid of it.
Yeah, and that, I appreciate your honesty. Everybody on the summit is very honest that, look, this is not 100% anything. It's a 80 to 90% effectiveness when combined with other things, which is brilliant, which is exactly what you said. Vitamin A is fantastic, high doses, the homeopathics, all these things in combination, food plan, all that really does make a difference. So that's a tough one. Herpes has been, I get a lot of calls about that one as well. And people are just frustrated with it and it's painful. So when they go through the MAH, the major autohemotherapy, when they go through, and I think you guys call it a 10 pass, right?
Well, you can do, I start with basically a 2 pass, okay, and then I can work it up. And most people for the herpes, 2 pass is sufficient. I've got some cases of Lyme now, we're doing a 4 pass or the 8 pass, but 2 pass is usually sufficient for herpes.
So what does that mean exactly? Just so everybody understands. What's a 2 pass?
It's the volume of ozone. A 1 pass is equivalent to about 120 milliliters of ozone. A 2 pass is equivalent to about 240 milliliters of ozone. So when I first learned about these oxidative therapies, it was learning about hydrogen peroxide. And hydrogen peroxide is H2O2. It breaks down into H2O plus an O radical. H2O is water, and we can only inject a certain amount of water in a patient, and otherwise it'll fill the red blood cells, they burst, and then the patient can die. And so we're injecting just a tiny amount of H2O2. But with ozone, because it's O3 and it breaks down into oxygen plus the O radical, that with the oxygen, we can inject tons of oxygen. And it almost seems like the skies are limitless in terms of what doctors are doing nowadays. And they're going this 10 pass, it's something like, 2,400 milliliters of ozone. And so it's getting up to high volumes of ozone.
Right. So that's great. And then there's 2 pass. How long does one session last?
It takes I book the patient in for about a half hour of my time, and then I'm usually move on to the next patient, and they're still sitting there. It takes the patient about 40 minutes.
Oh, okay. So that's not bad. So 40 minutes. And then typically, do they see a difference right away?
Some patients can. Majority people not right away. The one negative with the ozone treatment in this scenario is called a Herxheimer reaction. And a Herxheimer reaction is a die-off, where you've got all this virus in the body and now we're killing it. And the body's like, I can't deal with this. And you get kind of flu-like symptoms, achy joints. You just feel kind of garbagey for 3 or 4 days. And it can happen the second treatment, very rare for it to happen the second treatment. And on the first treatment, it's mostly 30 or 40% of people will get that. Then the others just won't notice anything other than just feeling better. Overall.
Yeah, and I know you don't know this, but on the summit, I speak every single day about detoxing before you do the ozone therapy, so you avoid the Herxheimer completely. And everybody who does it never gets even any reaction because they've been detoxing, right? But a lot of people don't know that. And so that's really frustrating for them. It's like they don't want to feel sick. They don't want to go through all the reaction. And sometimes that holds them back. But on this summit, we talk about detoxing beforehand so that helps a lot and you don't have to go through all of that. So that works out really well. So this is great. The herpes, and you said both herpes, simplex 1, simplex 2, everything, like you found it works for all the different types of herpes?
Yes, it does. And there's a herpes simplex 6, which has been linked into chronic fatigue syndrome. And it's something, there's a lab in the US that will test all the different viruses, and herpes simplex 6 comes up every now and again.
Those nasty viruses, they're just everywhere. And yet we have answers for them. So that's a really good thing. So we talked about the joints. You get great success using the Prolozone for that, for the herpes, for the teeth. Is there any other way that you have seen ozone, whether the modality that you use or for conditions that have been very successful for you?
I'm just trying to think. Done ozone into the tip of the penis. People don't want to hear that. And a penis shot with ozone. I was first, one patient I'm thinking of, he had Peyronie's disease, and it's a curvature of the penis where you get a lot of fibrotic tissue on the one side, and when the person gets an erection, it's very painful. And we did a P shot using PRP. He didn't notice any difference with that. And he came in, he had sarcoidosis, and which is a fungal infection in the lungs. And he came in and we were doing some IV treatments. After the second IV treatment, he came back and said he felt that night he felt something like a pop in his lungs. He felt something just kind of relieve itself. And he said his lungs have never felt so good. We did a further 8 treatments, so we did a total of 10 in him. But his lungs were just amazing after that. And then about halfway through, I said, we can try ozone in the penis too if you want. The PRP didn't work for your Peyronie's. Let's try ozone. So we did 1 treatment of ozone into the shaft of the penis. And he said again that night he felt like a pop, and that was it. The Peyronie's was gone. And he never had that problem again.
That's a massive difference. I'm sure the guys want to hear that, because there's all kinds of issues. They don't know what to do. And that's really interesting. I can imagine it was painful, though.
It was just a study of 1, but, it was an amazing treatment for this fellow.
Yeah, exactly. And so, who knows? I mean, it's something that is got very little side effects and has been proven over time through thousands and thousands and thousands and thousands of therapists that there's just no side effects. It's oxygen, it's just extra oxygen. So it works out very well, except for the Herxheimer, but then you could avoid that by detoxing. So we're putting it all together. So that's fantastic. So as far as modalities, you use the MAH, you use the injections. You had mentioned about doing the bagging and insufflations. Are you using those in your clinic as well?
A little bit, not a lot. I had one patient that wanted to try that. He was scared of needles, and he wanted to try that. And we were treating, again, it was herpes simplex 2, the genital. And he felt a lot better after, in combination with the vitamin A. And I think the rectal insufflation is similar to like a 1 pass, the amount of ozone that you can put in. And it gets into the circulation and gets in and helps to kill. And that's something people can do at home. Quite often I recommend that for, cancer patients or Lyme patients where they got to do a lot of ozone. Getting your own machine and doing it at home is way cheaper for you.
Yeah, exactly. Lyme and cancer, those folks really, really benefit by it and save a hunk of money by able to doing it at home. So overall, when somebody comes in, and then we'll close out our session here, overall, when somebody doesn't know about ozone, is a little bit worried about it, what do you do to educate people about ozone? What can you tell our listeners and our viewers about ozone to put them at ease that is safe and effective?
It's just oxygen. Essentially, it's using an oxygen tank. You need a spark to make ozone. After a thunderstorm, that smell is ozone. And so my machine is just like a mini thunderstorm in there. And it's just separating one oxygen molecule, combining it with another one, making an O3. And so essentially, at the end of the day, it's just oxygen. And it breaks down to that in the body. And so there's no harm to it at all, with the exception of getting it in the lungs. And if we're doing, if I wasn't doing the double ear thing, I'd be having a fan beside the patient, just blowing it away so that you're not getting it in the lungs.
Yeah, and that's what I used to do in my clinic. I would just have a little face fan and just blow it away, and it was fine, and it worked out really, really well. So it's simple. Like you said, it's oxygen. It's not a problem, and it just works. So, that's the cool part. So let's just tell everybody, those of you who are in Canada and are looking for a qualified, knows what he's doing, ozone therapist. Doc, where is your location? Where's your website?
We're in the West End part of Edmonton, Alberta, just south of West Edmonton Mall. And our business name is Natural Terrain Naturopathic Clinic. Website is naturalterrain.com.
Oh, that's easy. Naturalterrain.com. And they could call you, they could make an appointment. They could chat with you about ozone. My Canadian people are all looking, where do they go? And I didn't know that you did the teeth thing. So that's fantastic, because a lot of biological dentists are not using it due for whatever reason, they're doing other things, which is fine. But here you are doing the injections to save people from that root canal. That's a fantastic plan.
There's
And
no dentist in Edmonton doing any ozone at all. The closest, there's the one in Calgary, about 3-hour drive away. So I'm the only person doing dental. Even all the other naturopaths doing ozone work here in Edmonton, as far as I know, I'm the only one doing the dental stuff.
that's because they're all afraid of needles. I know I am. When they did the needle shot in my shoulders, I almost passed out. I'm not kidding. I'm horrible with this stuff. That's why I didn't become a medical doctor. So they put the shot in. I almost passed out. I said, lay me down because I'm going to pass out. Yeah, no, I'm terrible. But that's really one of the most effective ways is get that needle in, get it to the source, get the inflammation down. It works fantastic. So, Doc, thank you so much for your time. Again, your website is?
Naturalterrain.com.
Naturalterrain.com. We will have this on the summit as well. I highly encourage all of you guys who are watching to get a hold of this wonderful naturopath in Canada who really has it going on, knows what he's doing, 16 years and getting rave results. So I'm really, really excited that you were able to be here, watch this with us, and don't forget to share this with those people in your life who might also need this help. Doc, thank you again. I appreciate your time.
No problem. Thank you very much. It was an exciting experience to be on your summit.
All right. Thank you.